Is your college student majoring in public health? Are you unsure about what that major actually is? Do you think it's the less impressive version of a pre-med track? Do you want to know if they're actually going to be able to get a job? Or if you're going to have to rob a bank to set up a trust fund for them? If you answered yes to any of those questions, this video is for you. In this short video, you'll learn the basics of public health and the potential career paths that your college student might consider. By the end of this video, you'll have gained full confidence in your kid's choice to major in public health. Unless I don't sell this well, in which case I ask that you blame the public health system as a whole, or your college student for picking this major, basically anyone except for me. So what actually is public health? Public health is defined by Winslow as the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through the organized efforts and informed choices of society, organizations, communities, and individuals. In simpler terms, public health is just that, public health. Public health focuses on the health of entire populations rather than individuals. The goals of public health are to prevent and control illness and injury within populations, protect populations by addressing the social determinants of health, and promote healthy habits through research, advocacy, and policy improvements. Basically, it's all in the name. Many people incorrectly assume public health and medicine are synonymous. They are similar, but it's very important to note that they are not the same. The key difference between public health and medical care is who they serve. Public health is focused on populations, while medical care is focused on individuals. Public health focuses on prevention, protection, and promotion, while medical care focuses on diagnosis and treatment. To clearly differentiate between public health and medical care, I'll use cancer as an example. For medical care, an oncologist, in other words, a physician that specializes in cancer, will directly provide medical care through things like chemotherapy. An oncologist sees a patient one-on-one, often diagnosing and treating the disease. In contrast, public health professionals focus on cancer within entire populations, not within individuals. They may conduct extensive research on the causes and risk factors of cancer in hopes of preventing it. They may promote cancer screening programs to detect cancer. They may also provide resources and support to cancer survivors to protect them from further harm and disability. To summarize, while the doctors diagnose and treat, public health professionals research, advocate, and support. Within public health, there are 6 core subfields: epidemiology, environmental health sciences, biostatistics, social and behavioral sciences, also known as health promotion, health policy and management, and biomedical sciences. Your student will develop a basic understanding of these 6 subfields by the end of their undergraduate career. If your child decides to pursue public health further, they may even choose to specialize in one of these disciplines. Just to give you an idea of what these disciplines involve and what your child could choose to specialize in the future, I'm going to briefly describe the subfields of epidemiology and environmental health sciences. These 2 disciplines are especially important for students who choose to pursue a Bachelor of Science in Public Health. Again, these are only 2 of the 6 disciplines, but it will give you a glimpse into the vast, multifaceted world of public health. And it may help you and your student explore careers within the public health field. Epidemiology is the study of how and why diseases spread within populations. Epidemiology focuses on who is getting the disease, when they got it, and where it's present. This is a very important discipline for preventing and controlling diseases. For example, the discipline of epidemiology was incredibly important during the COVID-19 pandemic, which is something I'm sure we all remember very well. Epidemiologists that focused on COVID-19 collected data to determine the number of people infected. Using this data, they were able to identify certain patterns related to the spread of the virus, thus allowing them to determine the causes of COVID. Without those hardworking, dedicated epidemiologists, the virus would have likely continued to spread at the rates we witnessed at the peak of the pandemic. If we ever see another pandemic like COVID again, which we ideally won't for a long, long time, your child, a potential future epidemiologist, could be part of the solution. Speaking of being part of the solution, let's further explore what it means to be an epidemiologist and have a career in epidemiology. Epidemiologists usually work in offices and labs, often for local and state governments. The U.S. Department of Health and Human Services, specifically a division of that department called the CDC, is a major employer of epidemiologists at the federal level. According to the Bureau of Labor Statistics, the median pay for epidemiologists is $83,980 per year. Typically, for entry-level positions, a master's degree is required. Employment in this field is expected to grow by 16% in the coming decade, which is much faster than the average. Clearly, epidemiology is a promising field if your child is interested in it, and a degree in public health will help them get there. The discipline of environmental health sciences is, as you can probably tell, about the environment. It's about how our natural and built environments, the ones that surround us all the time, impact our own health. Water pollution, air pollution, soil pollution, noise pollution, all of these things impact the environment, thus impacting us. Environmental health is focused on that connection, that growing knowledge of how our everyday environments impact our health. More so than ever, this subfield is critical for understanding and improving health. If your student is interested in this field, careers as air pollution analysts, environmental health specialists, and policy advisors await them. There are 4 federal public health agencies that are important to know, especially because they could be your student's future employer. First is the CDC, the Centers for Disease Control and Prevention. The CDC is the main assessment and epidemiological agency for the nation. Next is the EPA, the Environmental Protection Agency, which does exactly what it sounds like it does. It protects the environment by cleaning up pollution and controlling toxic substances. Next is the FDA, the Food and Drug Administration. This federal agency, of course, ensures the safety of food and drugs, but it also regulates medical devices, vaccines, diagnostic tests, animal drugs, and cosmetics. Finally, the NIH, the National Institutes of Health, is the primary federal agency for biomedical research. One really important thing to note about the NIH is that it funds a lot of the research that universities do, including CFC. So who knows, maybe your student will one day work on research that is funded by the National Institutes of Health. Everything I have just informed you about ultimately culminates to create the core functions of public health: assessment, policy development, and assurance. Assessment refers to the collection and analysis of public health information. This function aims to monitor health and identify health problems. Policy development begins after all the information is gathered during assessment. Policy development refers to how that information is used to create and implement policies that better the health of the community. Assurance, the final core function, involves ensuring that the appropriate health services, resources, and programs are available and effective. It also involves enforcing policies that were created during policy development. Hopefully you now understand how all the previous information I provided you fits into these 3 core functions. That concludes this brief presentation on public health. There is, of course, much more we could discuss in the vast field of public health, but it is my hope that this allowed you to become a bit more familiar with the major your child has chosen. More specifically, I hope you know that your student is not wasting money on a useless degree. Public health is a great field, and it is something that will always be needed. Your child will truly be making the world a healthier, safer place for everyone with this degree. Plus, if you get lucky, you may not have to rob any banks for that trust fund now.